Hi guys, welcome to Pathopulse_Radhika. So the question for today is a soft tissue mass from a patient presenting with sensorineural hearing loss and tinnitus was excised and the histopathological examination of the lesion is shown. What's the likely diagnosis? Lymphoma, schwannoma, meningioma, astrocytoma, and you have an HP image here. So any guess what it is? With the history only you can diagnose. It's a typical history. Adding to that you have an HP image, histopathology image of the excised lesion. So before going into the answer, let me discuss about the features which are depicted here. So as you can see in that figure, you have two areas, the areas which appear dense and areas which appear loose. Those areas which appear dense like here as shown here, they are called Antony A areas. Those areas which are loose, we call as Antony B areas. So what do you see in Antony A area and Antony B area? First, coming to Antony A area, you have spindle cells, right? You have spindle shaped cells which are arranged in fascicles. Okay. And in Antony B areas, what happens? You have like these white colored areas, right? Those are nothing but space myxoid change. Okay. So you have very few spindle cells which are interspersed with this myxoid areas, loose extracellular myxoid areas. So you are having an Antony A and Antony B area. Then what happens in this the spindle cells is the spindle cells will slide over each other. We call them palisading, right? So as you can see here, you have palisade. The nucleus will palisade and you have a central cell-free, nuclear-free zone. So this we call it as a Verroque body. Okay. So you have Antony A area, Antony B area, palisading and Verroque bodies. Now I think you can come to a diagnosis. So you have a patient with sensorineural hearing loss and tinnitus. Why do you have all these complaints? Because you have this lesion in the cerebellopontine angle which can compress your vestibular nerve. Okay, because of the compression of the vestibular nerve, you're having all these uh, hearing loss and tinnitus, and this history is typical of a schwannoma. So answer here is a schwannoma. Okay, so schwannoma is a benign tumor of peripheral nerve sheath. Okay, so they have Schwann cells which are arranged in the spindle shaped cells, so in fascicles, right? And they can be sporadic or they can be associated with neurofibromatosis 2, NF2. So anyone, what's the chromosome number for NF2? Remember 2, no? It's 2. So it's 2, 2, 22. So the chromosome of NF2 gene is located on chromosome number 22. And on gross appearance, your schwannomas can have cystic areas, necrosis, and hemorrhage. And the histopathology I've already described, you have Antony A, Antony B areas, Verroque bodies. They can show cystic change, they can have hemorrhage, they can have necrosis as well. So this is to do with this typical history and the morphology. And in short about the other options, lymphoma. Lymphoma can occur in your central nervous system, but they are small round blue cell tumors and the morphology will be like that of a small round blue cell tumor. And astrocytoma usually occurs in the cerebral hemispheres. They present with seizures, and with this morphology your astrocytoma is not the diagnosis. And coming to meningioma, meningioma will have walls of meningothelial cells. So these are meningothelial cells, they will be in walls and they can have some or more bodies. And this is about the various other options discussed. Okay, thank you.